Hello, everyone. This is Raj, Doctor of Physical Therapy. I am live on Facebook page and Facebook group, and as well as YouTube. So, if you are watching this live broadcast, please comment that you where which country you're from, and if you have any questions, feel free to post those in the comments, and I will read those and try to answer those questions. And Ryan Perron, Doctor of Physical Therapy, as well. He will join me anytime now. So he's figuring out the system, and this is a learning process for us. So we are trying to learn the Facebook and other softwares to go live. So bear with us while we are learning and doing our best. So today we were going to talk about a couple of questions that came up in a chat group. We have a Meet Your Physical Therapist chat group, and we are um, answering some of the questions in a general way. We don't want to answer any specific questions for individual person. It has so many legal issues, so we can't treat anybody other than the state we are in. So, for example, I am in the state of Oregon in the United States, and I can see and give, talk to patients that are in Oregon. But hi, Ryan. So you're live, and so Ryan is in Idaho, so he can treat patients in Idaho, and he can answer anyone in Idaho online or video calls, but he can't treat anyone in Oregon unless he has a license in Oregon. So that's how it works. So that's why we can't really answer every question from anywhere. So please understand that. So the questions must be general in nature. Um, so one of the questions we received today was frozen shoulder. Somebody was asking, how I'm getting some therapy, but I want to do more um, at home, and what should I do to, improve my frozen shoulder? So in my experience, frozen shoulders are painful and very limiting. They can shoulder movements in flexion and abduction on the sideways are going to be very restricted, so very limited and very painful. But most of the cases, after several weeks or months, the frozen shoulders subside by themselves. So they'll be able to raise their arm, and pain decreases. And without any intervention, it can go away. However, I would highly recommend consulting with the physical therapist, and you still have to do physical therapy to improve and heal faster. So if you don't work on your shoulder with a physical therapist, most likely you're going to not do anything, and that causes muscle weakness, muscle atrophy, resulting in prolonged, healing process. So I would highly encourage you to start doing physical therapy after frozen shoulder. And I have um, there after the live stream, I will post some articles showing some exercises for the shoulder, frozen shoulder. So that's one topic that. Do you have anything to say, Ryan, about frozen shoulders? Any your experience?
Yeah, well, just a correction there. I'm in Utah. I know. I'm from Idaho, but I'm in Utah right now, just practicing. Um,
Oh,
but anyway, about the frozen shoulder is it's a process. You know, it kind of goes through its time of just having that frozen shoulder, adhesive capsulitis, and so with that being said, we want to make sure that you go through the stretching process before you even try to strengthen it. And so you just, follow the advice of your physical therapist, and the focus should just be on the stretching, and don't worry about the strengthening on your shoulders. So I think that's an important thing to know with that perspective, because it's painful, it's weak, but people might start thinking I need to strengthen it and whatnot. But just make the stretching a priority, and it'll take some time, but then all of a sudden it just finally feels like, okay, now it's starting to respond. But it's a frustrating process. Yeah.
yes. Great, thank you. And another question was, I'm suffering from joint pain in the knee, right knee. Kindly advise me suitable exercise. Um, this question is from someone in India. They were asking some exercises. How would you answer that question? Knee pain.
Well, I always ask for a history. What caused it? Was
That's
it in city? Like I don't know what happened. I just woke up and it was sore. Maybe what you did the day before. A lot of walking or something. The soreness didn't show up till a day or two later. So that's always an investigative find that you're trying to get to. Is arthritis too. You know. And so, if it is arthritis, my recommendation is I always tell my patients that arthritic pain, joints, we can't change that. We can't make the knee joint better. We're not going to change the arthritis in it. But what we'll do is help improve the tolerance. So, and what makes sense is when I ask them, let's say somebody walks for 20 feet and then they have to stop because the pain's an 8 out of 10. Okay, so we do therapy and that, and then all of a sudden now they're walking 80 feet before they have to stop because the pain's an 8 out of 10. But to the individual, they might feel like it's not getting any better because it still hurts. It's still an 8 out of 10 no matter what I do. But our job as a physical therapist is to see, okay, but you're going from 20 feet to 80 feet, we've improved your tolerance. And so it did get better, but it doesn't change the arthritis in the joint. It's just improved tolerance. And so when we exercise arthritis, I avoid like objective measures like, okay, we got to do 10 of these or 5 minutes of this or that. I just say, listen to your body. If your joint says, okay, I need a timeout, then take a timeout. With arthritis, you just have to listen to it, but you don't. That doesn't mean that has to keep you down.
right. And that is something I want to say. People always keep asking very general questions, and that's good. So that's, as I told you earlier, we can't really answer very specific questions. But what I mean by very broad question, knee pain and exercise, we can't really give you an exercise without knowing some of the details like diagnosis or any pertinent history. um, if you would like to exercise, I mean, squatting is a good exercise for knee. So you can perform like 30 squats once a day, and that will strengthen your knees. But that's a very general exercise. And if you need very specific exercise, there are so many ways to do those knee exercises. You can use therapy bands, you can use weights, ankle weights, you can perform body weight exercises. You can use huge equipment in the gym to strengthen your knees. So there are so many different ways to strengthen, but it depends on what resources you have. And that's the reason why it's important to go to a physical therapist, so that you get the basic education, get a home exercise program, you go home and do those exercises on your own. So, okay. And the another question we got was, this is also from India, West Bengal. I'm suffering from diabetic neuropathy and leg pain. They're expecting some sort of help with physical therapy. What would you say, Ryan?
Yeah, I would always say motion is lotion. You just got to keep moving. You got to do what you can tolerate. And when you have good days and bad days, it's just still within your tolerance. Being on your feet, the blood flow that you get from the walking and standing on it. Those are some of the best things to do. If the weight bearing standing on it's too much, there's exercise that you can do sitting down where you're using your skeletal muscles in your legs to help push the blood flow through. But when we have neuropathy, that's a tough one. Nobody knows really how to uh, eliminate the neuropathy. It's just a thing in the nervous system where it just starts deteriorating, and the nerves responding to it could be just no feeling at all to tingling pain, sharp burning pain. So it varies for everybody. But most important thing is you don't want that to um, make the rest of your body in a state of decline. And so you want to just stay active as best you can. That's my advice with neuropathy.
Right. Thank you very much. And I'm trying to, sorry about all these. I'm trying to add a screen share. Let's see. I would like to show people those exercises that I posted in the chat, but it's hard to show on live. So I will post those articles in the chat after the live stream is ended. Um, so, are there any specific exercises for arthritis? Let's say, let's take osteoarthritis. Um, I know. I think you mentioned it. Motion is the lotion. Keep moving. But are there any generalized exercise, like not the squats, but we can we can do isometric quad sets, sharp torque quads. So those are some of the things that we can definitely work on for arthritic conditions. um, uh, can you think of anything else, Ryan? How about for frozen shoulder? Do you have anything in general to talk about?
Yeah, well, with the arthritis in the knee, I would say, what the objective is, the goal, you know what I mean? Like what your activities of daily living, some people are, it's not like we're 22 years old anymore and want to get back into football or basketball. So we want to avoid exercises that are geared towards that. But the exercises that we would do with arthritic knees is geared towards more, hey, I've got 5 steps I got to get in and out of the house every day. So we kind of base our interventions of exercises to help meet the activities of daily living that the person has. Oh, I want to be able to get to my mailbox, which is 100 yards from the house or something. So we want to be able to gear specific exercise for that, because the body's going to adapt specifically to what you do. And so um, that would be just like walking, and doesn't mean we got to go up and down 20 steps a day to get better to do 4 steps, if you know what I mean. And
Yes.
so, and like I said, it's not what you do, but how you're doing it. So if you're thinking 3 sets of 10, you might overdo it one day. And but if you're just going by what your knees can tolerate without overdoing it, then that's going to help you progress. It's a slow process, but it's steady.
Okay, great. So, how about frozen shoulder? Are there any specific things that we can recommend? Like, I
Well, I would say like with the frozen shoulders, when we do the stretching and that,
how
evidence find
about,
that a prolonged stretch
yeah, finger
is,
ladder.
yeah, yeah, uh-huh.
So
And then just
you,
holding that stretch as long as you can. You know what I
yeah,
mean? It's not like a 20-second stretch, or, I go for at least a minute, just
okay,
because there's muscles after 30 seconds, there's some tissues in the muscles that start to tell it, okay, relax.
yes.
And then you have to wait at that 30 seconds to get that to fire. And then after 30 seconds, then it can start to get a little more of a stretch in. So I'd say it's about a minute stretch at least.
Right. I usually tell my patients about 15 to 30 seconds. You know, as I think somewhere I read that after 30 seconds, it may not be as effective. I mean, it's nothing wrong, but there may not be a huge difference in holding for a minute or 2 minutes compared to
True.
holding for 30 seconds. I think that's what I read. And I always tell my
Yeah.
patients 15 to 30 seconds. But that's good. So I'm looking at this is a publication, Harvard .edu publication, and they recommend pendular exercises for the shoulder and towel stretches. So putting like as if you're drying your back with towel. So that's a good exercise where your shoulder is going into flexion and external rotation. So that's a good exercise. Finger walks, as I mentioned, finger ladder, and a cross body reach. So reaching across with the one hand to the opposite side. And the key is pulling the elbow towards the other opposite shoulder. So that's the good stretch for the shoulder. Um, yeah, so those are the main topics today: frozen shoulder, arthritis, and we had one more. Um, but that's pretty good. You know, we are taking questions from chat group and talking about those in the live videos. We try to do this every Wednesday. We might change the time because of we try to go with a time. We will come up with a time that will help most people that are in the group. It's a kind of a daytime rather than right now. It in India it's very early, like I think it's 5:50 or something, and same in Philippines or other countries. It is still early, so we will try to make more live videos, and we will come up with a better time so that more people can join and benefit from our discussions. And obviously, we are going to get better as we do this. We are going to get better at presentations, and we understand the software, how to use it. Yeah, thank you very much for joining me, Ryan. Is there anything you want to mention before we stop the live stream?
I just say it's a process, getting better. It takes time. It's not going to come over in the weekend, but what you
Yes,
have control over is the environment you put yourself in to try to make it better, and stick with it.
yes. Thank you very much. I appreciate your help and take care, everyone. Bye bye.